Hi, everyone, and welcome to our debate. My name is Haley, and I will be the moderator. We'll start off by introducing all of our group members. First, we have Kristen as the stater.
Hello.
Jessica as the pro-prover.
Hi.
Kayla as the con-prover.
Hi.
Greg as the pro-attacker.
Hello.
And Miriam as the con-attacker.
Hello.
The issue we will be debating is the use of punishment-based interventions. These are among the most controversial treatments for behavior disorders in applied behavior analysis literature. The controversy concerns both the efficacy and the ethics of punishment, as well as that both researchers and practitioners tend to argue for or against the morality of punishment by developing a position on its efficacy. Some scholars have argued that punishment is unnecessary, claiming that reinforcement-based strategies provide the efficacy of punishment without harmful side effects, making punishment unethical. Alternatively, other scholars have argued that punishment, especially when used in conjunction with reinforcement, has efficacy superior to that of reinforcement alone, making punishment at least sometimes ethical. In this debate, we will consider the ethical code, as well as the literature, to argue whether or not the use of punishment is ethical and determine its efficacy. Right now, I'll just share a visual to define reinforcement and punishment. So according to the definitions by Cooper, Heron, and Heward, 2007, punishment is a two-term behavior where the consequence's functional relation is defined by its effects on the future frequency of that behavior. Punishment has occurred when a response is followed immediately by a stimulus change that decreases the future frequency of similar responses. They also define reinforcement as when a type of behavior is followed by reinforcement, there will be an increased future frequency of that behavior. So simply put, punishment decreases the likelihood that a behavior will occur in the future, and reinforcement increases the likelihood that a behavior will occur in the future. Kristen will now state the first point of the debate.
So the first point to be made by the pro-punishment side in regards to the literature supporting the idea that punishment is an effective procedure in reducing or eliminating maladaptive behaviors rapidly. It has also been found that behavior change programs using positive reductive procedures may benefit when combined with punishment. So Jessica, I'm going to hand this off to you and let you begin by proving this point for the pro-punishment side.
In 1969, a study by Lovas and Simmons showed that punishment was immediately effective in reducing self-injurious behavior. In comparison to placing students in a room by themselves, the behavior was immediately suppressed when an electric shock was administered, and when the shock was taken away, the behavior returned, showing the effectiveness of the punishment procedure. A study by Lovas in 1987 also showed that 90% of children substantially improved when using the Lovas method, and over half of these children were able to achieve a normal IQ and tested within the normal range for social and adaptive skills. A study by Hanley, Piazza, Fisher, and Maglieri in 2005 showed in their study that clients preferred treatments when punishment was part of the treatment plan. In their study using functional communication training, they used procedures that involved punishment and procedures without punishment, and proved that the procedures were more effective when punishment was used. Also, when the clients were asked to choose which treatment they preferred, one student picked the treatment with punishment 79% of the time, and the other picked punishment every time during her last 5 sessions. This directly relates to Code 4.02 involving clients and treatment. The client should have a say in which treatment they prefer, and this will make treatment more successful because the client will be more invested in their own treatment and will be happier with the treatment being used. I will now pull up a graph. The graph shown is from Fisher and colleagues 1993. The top graph shows that during baseline, there was a high rate of destructive behavior and a low rate of functional communication. As functional communication training was implemented, communication increased and punishment decreased, but was still somewhat variable. The bottom graph shows that the rate of destructive behavior per hour remained high and variable during functional communication training and the use of extinction. But when punishment was introduced with the use of functional communication training, the rate of destructive behavior immediately dropped and remained at a decreased level.
Thank you, Jessica. Miriam, what comments do you have about the effectiveness of punishment alone and when used in combination with reinforcement? What arguments do you have against the findings that Jessica has just provided?
In regard to the Fisher et al. Study of 1993, it can be seen in the first graph that functional communication training did actually decrease destructive behaviors. During baseline, destructive behaviors were high and communication was low, but once functional communication training was introduced, the destructive behaviors decreased and communication increased. You have also said that punishment is successful when combined with reinforcement. Reinforcement, unlike punishment, can be successful on its own. Differential reinforcement is a very useful tool for reinforcing behaviors because it helps decrease the behavior as well as teaching alternative or incompatible behaviors that can be engaged in instead. Cooper, Heron, and Heward of 2007 explained differential reinforcement as being able to reduce behavior utilizing two components. These include providing reinforcement based on the occurrence of an alternative behavior or the occurrence of the problem behavior happening at a decreased rate, as well as withholding reinforcement as much as possible when the problem behavior occurs. Differential reinforcement is one of the least intrusive of all behavior interventions, and this is probably why it is so popular. Differential reinforcement does not involve extended interruptions like timeout. It does not rely on the removal of positive reinforcers like response cost, nor does it present aversive stimuli to the individual like punishment. Differential reinforcement has a dual effect. It weakens the problem behavior while simultaneously strengthening acceptable behaviors that are incompatible or alternative behaviors.
Thank you both of you for stating your positions. Although the pro-punishment side has suggested that punishment can increase the effectiveness of reinforcement procedures, the con-punishment side is arguing that when implemented alone, reinforcement is more effective than when punishment is implemented alone. Kayla, please provide us with the support for this statement.
Punishment is only shown to be effective in combination with reinforcement. In 1993, Fisher and colleagues showed that functional communication training was effective in reducing some destructive behaviors, but not as efficiently when used with punishment. This study also shows that when using functional communication training in reinforcement procedures, replacement and adaptive behaviors were taught successfully, but punishment could not do this. Ethical Code 4.08 states that a replacement behavior and a way to teach the behavior must be in the plan if using punishment. So punishment shouldn't be used alone, and this code supports the idea that punishment will not be able to teach new replacement behaviors. In 2009, Wheatley and colleagues found that the following evidence-based practices are effective when reducing problem behaviors in common areas of schools without utilizing punishment: establishing a common language to communicate behavioral expectations, delivery of specific praise, active participation of school personnel, token reinforcers that are delivered immediately in exchange for other reinforcers later on, and the use of differential reinforcement of incompatible behavior.
Greg, Kayla has made several points that reinforcement on its own is effective without punishment. Can you provide us with support of when punishment should be used and if it can be used effectively on its own?
Well, let's first by just saying that punishment is an effective procedure. Code 4.08, which is part of the ethical standards for BCBA, does state that punishment can be used. Punishment has one use, and that is to quickly suppress the behavior. This would be the main goal when dealing with major aggressive incidents or self-injurious behavior. Code 4.08 also states that we should use punishment as well as reinforcement at the same time to help the individuals learn alternative behaviors. This would also be true as no matter whom you are working with to try and change behavior, we would want to look at an alternative behavior that they would need. The research does not show how reinforcement alone can quickly stop, let's say, a self-injurious behavior. Punishment has been proven to quickly stop a behavior, and then from there we can start to look at where we go next. The bigger issue around punishment is the fact that people have not been able to replicate it successfully outside of a clinical setting. Lovas, in his 1987 article, stated that it is unlikely that a therapist or investigator could replicate our treatment program for the experimental group without prior extensive theoretical and supervised practical experience in one-on-one behavioral treatment with developmentally disabled clients as described here, and without demonstrated effectiveness in teaching complex behavioral repertoires as in imitation behavior and abstract language. It is unfair to state that punishment is not as effective as a reinforcer when it has been proven to be effective. The problem arises that in a non-clinical setting, therapists who are not trained correctly or staff whom are not trained don't use punishment immediately, consistently, frequently, or with the proper intensity. The stigma around punishment has been created due to improper training and is not a result of it being an inadequate treatment model.
Now that we have heard from both sides why punishment and reinforcement procedures are effective together and alone, we'll move on to our next topic. The con-punishment side will provide an argument in relation to the Ethical Code 4.09 regarding the use of least restrictive procedures. Caleb, please explain to us why reinforcement rather than punishment would be less restrictive.
According to the Ethical Code 4.09, we should always recommend using least restrictive procedures. In 1969, Rackman and Teasdale indicated that reinforcement procedures should be implemented as part of a regular procedure, and punishment procedures should only be used when other procedures have been unsuccessful. In 1980, Homer and Peterson stated that reinforcement procedures have been proven to be comparably effective as punishment procedures, and positive procedures avoid the unpleasant effects that may occur when using punishment procedures. Reinforcement procedures that have been proven to decrease problem behavior include differential reinforcement of other behavior, low rates of behavior, alternative behavior, and incompatible behavior. These reinforcement procedures are easy to implement and are constructed on providing positive reinforcement, which avoids any ethical concerns that may arise while using punishment procedures. In 2009, Wheatley and colleagues conducted a study in which they utilized differential reinforcement of incompatible behavior in schools due to a need of low-cost, high-impact strategies to increase appropriate behavior. It taught specific appropriate behaviors, provided opportunities to practice skills, and implemented systems to reward students for behaving appropriately. Right now, I will provide a graph from that study to show the effectiveness of reinforcement strategies. The graph shows a significant decrease in target behaviors that were occurring in school common areas. Common areas are where 50% of target behaviors occur in schools, and they include areas such as hallways, lunchrooms, playgrounds, bus lines, and buses. The target behaviors included in this study include littering, which was decreased by 96%, sitting inappropriately, which was decreased by 64%, and instances of running, which were decreased by 75%. In this study, positive behavior support was implemented to decrease the target behaviors, and it was successful. As I previously stated, multiple evidence-based methods were used to reduce these problem behaviors. They included providing clear expectations and using common language, consistently delivering praise, encouraging active supervision, implementing token economies, and utilizing differential reinforcement of incompatible behavior.
Greg, Kayla has used code 4.09 to support the use of reinforcement as a less restrictive and less intrusive procedure. But when would punishment be considered the less restrictive procedure?
Well, why would we want to use a less restrictive procedure if someone is constantly banging their head with great intensity against hard objects? It does not seem to me that using the less restrictive method at this point would make sense. Why would we not immediately look at how we can suppress the behavior and then look at creating the alternative behaviors? The responsibility of explaining to a parent that I am sorry your child has brain damage, but I had to try the less restrictive intervention first, is not a conversation I personally would ever want to have. Ethical Code 2.09 states that clients have a right to effective treatment. Therefore, if punishment is the best procedure to start with, that is what the BCBA should consider. The BCBA would explain to the parent or individual, if they're their own guardian, why they are choosing punishment first, and explain some of the research behind it. Everyone has a right to treatment, and we should be providing the best treatment possible on a case-by-case basis. An overreaching principle throughout life and for BCBA is to do no harm. There is no BCBA whom is ever going to knowingly place one of their clients in harm's way. The other great part about a punishment procedure is that the procedure is going to be reviewed by a select group of people, and they're going to make sure there's a justification for the procedure being used, that alternative behaviors are being looked at by the BCBA, and we're attempting to fade out those procedures over time. No matter what procedure you use, whether it's punishment or reinforcement, we need to always be looking at how we stop the procedure so that the added stimuli to the person's life can be discontinued, and the natural environmental contingencies that occur can take over to meet their daily needs. The golden book that many BCBAs refer to when discussing behavioral literature is by Cooper, Heron, and Heward, 2007. In that book, it states, punishment is a legitimate therapeutic technique that is justifiable and commendable when it relieves persons of an even greater punishment that results from their own habitual behavior.
Now, the pro-punishment side is suggesting that in situations where reinforcement has not been found to be effective in reducing maladaptive behaviors, punishment can potentially be allowable and be viewed as a less restrictive procedure. Jessica, what support do you have in regards to this statement?
According to the BACB Code 4.08, Sections B and C, states that reinforcement procedures should always be used if punishment procedures are necessary. It also states that if the behavior is dangerous enough, immediate aversive procedures can be used. And if the behavior is not dangerous, appropriate steps must be taken in order to implement reinforcement along with punishment procedures. Code 4.05 also talks about conducting a risk-benefit analysis to support that the benefits of punishment outweigh the risks. Cooper, 2007, also discusses the right to effective treatment. Cooper states that by failing to use a punishment procedure when it is absolutely necessary may be failing to provide effective treatment for the client and may put the client in harm's way.
Miriam, both Greg and Jessica have made valid points supporting the use of punishment and stating that it could be used over reinforcement as a first choice in some situations. Please explain to us why you would not automatically choose punishment as a first choice.
Greg, I would first like to briefly go back to something you mentioned. You are correct. Ideally, nobody would intentionally put someone in harm's way in order to be able to use a punishment procedure. However, this may be done unknowingly. Cooper 2007 does say that people have a right to effective treatment, but who is saying that reinforcement is not effective? I would also hate to tell parents that we jump straight to a punishment procedure without trying the least restrictive alternative first, for the mere fact that we thought it would end the behavior quickly. We do not know that this will be the case. There are other ways to decrease a behavior without using punishment. Yes, we want to end dangerous behaviors quickly, but reinforcement can also do this. Athens and Vollmer 2010 showed differential reinforcement of alternative behaviors to be effective without the use of punishment and extinction. And this is possible due to the fact that it uses more immediate, longer durations, and higher quality of reinforcement for appropriate behaviors relative to the reinforcement given for problem behaviors. For example, this child is engaging in self-injurious behaviors or aggressive behaviors towards others. It may not always be possible to withhold or delay the reinforcement at this time, but it is possible to manipulate the other parameters of that reinforcement, such as the duration or quality of the reinforcement given. This could mean that if the function of this behavior is attention, then minimal attention at this time is given or given in a monotone or boring manner, and that increased attention or more fun ways of attention, such as laughing or giggling or providing hugs or tickles, can be used when reinforcing the absence of this behavior. This will make the patient want to refrain from engaging in the behavior so they get the positive attention that is more fun. It is also helpful to note that intermittent schedules of reinforcement help because it can help mimic the natural environment.
So far, we have discussed whether or not punishment and reinforcement are effective and when they are both considered to be less restrictive. Now, the pro-punishment side will argue their next point, stating that punishment procedures should be viewed as humane and ethical due to the fact that consent of the client or caregiver must be provided prior to the implementation, and how this relates to Code 2.09, the right to effective treatment. Jessica, please provide us with the pro-punishment side on this position.
The study done by Hanley, Piazza, Fisher, and Maglieri in 2005 demonstrated parents being involved in the use of punishment by allowing the parent to choose what would be used as a punisher and what they thought they could consistently implement at home. This ties directly into Code 2.09, right to effective treatment, because the parent is given the choice of what they think will be most effective as a punisher for their child. The Judge Rottenberg Center in Massachusetts uses a form of shock therapy as a means to decrease or eliminate severe self-injurious behaviors or aggressive behaviors. There are numerous parent testimonials on their website praising the center and the job they do with their children. The parents make the choice to send their children to this center and give consent to the use of these methods. The parents state that many of their children would be in a psychiatric facility or heavily sedated, and due to the work of the Judge Rottenberg Center, they are able to be more independent and have been taken off of many of their psychotropic medications. This could also be seen as using the least restrictive approach for treatment due to the fact that the children are no longer heavily sedated and not in a psychiatric facility.
Miriam, Jessica just provided us with support as to why the pro-punishment side is rejecting these claims. Please prove to our audience why you believe punishment is inhumane and unethical.
I will gladly do that, and I will first start by sharing a video from the Judge Rottenberg Center.
This is the video that the Judge Rottenberg Center in Canton has fought long and hard to keep from the public eye. The center convinced a judge 8 years ago to seal it, and the battle continued right up until it was played in court, as lawyers for the center asked the judge to bar our camera from recording it. The judge said no, and now for the first time ever, the public can see for itself what these controversial electric shocks look like in use. Dramatic video of New York teenager Andre McCollins, restrained face down, a helmet on his head, screaming for help. Judge Rottenberg Center calls it treatment.
I was shock number 16 or 17. I was 31 that day.
As McCollins' attorney just described, the teenager was shocked 31 times in all that day in 2002. McCollins is suing the Canton-based center, calling it torture. Lawyers for the center and its clinicians say McCollins needed aversive therapy because he was aggressive.
These are dramatic takes. There's no question about that. But the treatment plan at the Rottenberg Center, the treatment plan that Andre had in place on October 25 was followed.
It was an emotional day for McCollins' mother, Cheryl, who was in court as video was played from the beginning of Andre's ordeal, when he was shocked and restrained after refusing to take off his coat.
I never signed up for him to be tortured, terrorized, and abused. I had no idea that they tortured the children in the school.
Cheryl testified what her son was like when she visited him 3 days later.
I couldn't turn Andre's head to the left, to the right. He was just staring straight. I took my hands and I went like this. He didn't blink.
Cheryl McCollins did get Andre to Children's Hospital that day, where he was diagnosed with acute stress response caused by the shocks. The jury also heard her testify about watching the video and hearing staff members laughing while her son was on the floor. We should see more video on Wednesday in court as Cheryl McCollins returns to the witness stand.
As you can see here, this individual was shocked 31 times. And not only that, but the center asked to keep this video out of the trial, but the judge ruled against it. His mother admitted to enrolling him here, but she also said she did not sign him up for abuse. Yes, parents can and should have a say in the treatment of their children, especially in the cases where the children cannot make these decisions on their own. But can we honestly say a parent would knowingly put their child through this sort of treatment? Her son was shocked for not taking off his jacket. I do not see that as any sort of behavior that requires this form of punishment. Yes, this form of punishment may be effective in regards to decreasing behaviors because, as she described her son, he sat still, not moving. However, creating a catatonic-like state for someone is not what I would consider a successful procedure to decrease behaviors. As behavior analysts, we have multiple obligations. These include, but by no means are limited to, doing no harm, respecting autonomy in order to help promote independence, benefiting others, being just, and treating patients with caring and compassion. This treatment is clearly causing harm to the young man. It is important to remember what the subject wants out of treatment, as well as what the parent wants. After all, this is to be done to help the subject, not the parent. If the exact treatment was spelled out for the parents and the subjects, I do not believe anybody would sign up for this. What about this seen as benefiting anyone? What good is shock doing to these people? Are you saying that if you engaged in a dangerous behavior, you would be okay with someone strapping you down, placing a helmet on your head, and shocking you multiple times while you beg for them to stop? We are to do to others what we would like to happen to us. I know I would personally not enjoy being shocked, no matter what effect it had on my behavior. Is it caring or compassionate to do these things? I would think that finding a least restrictive way to decrease these behaviors would be more caring and compassionate. I would even go so far as to say that the behaviors they are engaging in are sometimes more compassionate because they may not inflict the type of pain that these procedures are causing. I won't go into detail about every ethical code this violates, but these are some of the basic essentials each human being should be ethically obligated to uphold. And the argument that punishment, specifically the Judge Rotenberg Center, is effective and should be allowed due to parent choice seems ridiculous. Rather, I would argue that the use of punishment is inhumane and that reinforcement has been found to be effective in reducing problematic behaviors.
Miriam has pointed out several violations to our codes and principles. So she has also provided us with a clear example of how punishment can be severe and potentially harmful. Kayla, what does the literature state about the negative side effects of punishment?
In 1980, Homer and Peterson stated that punishment procedures have resulted in aggression and unpleasant reactions. The researchers have also indicated that punishment procedures may be subject to inappropriate use and misinterpretation. This may include overusing or forcefully using punishment procedures. In the study done by Fisher and colleagues in 1993, the researchers looked at the effects of using functional communication training and punishment with all of their clients. The researchers found that in one of the cases, aggression and self-injurious behavior increased when punishment was implemented alone for disruptive behaviors. However, when punishment was included with functional communication training for disruption, rates of aggression and self-injurious behavior stayed low. In this case, the study revealed that functional communication training may have prevented the occurrence of aggression and self-injurious behavior by increasing communication. This study has shown that when reinforcement procedures are used alone, they are proven to be effective in decreasing maladaptive behaviors while increasing adaptive behaviors.
Greg, Miriam and Kayla have just provided us with examples about the negative side effects of punishment. What is your opinion on this topic?
I'd like to first start off by just saying that the Judge Rotenberg Center is still open to this very day, has been to court multiple times, and has always won their case. So clearly in the court's eyes, punishment is allowable. But again, let's discuss Ethical Code 2.09, which states that an individual should have effective treatment. Why would we not use punishment procedures when they are effective, fast, and may save a child from serious brain damage or injury? We can work on teaching the alternative behaviors after these behaviors have been suppressed and the individual is no longer a danger to themselves or others. Places like the Judge Rottenberg Center conduct punishment in a clinical setting with constant oversight from their clinical staff. It is these punishment procedures that some call inhumane that parents call life-saving. Are we trying to say that in order to save someone's life, we would never consider punishment when it has been proven effective? I would certainly hope not. With that said, parents and BCBAs should not be implementing punishment procedures without the proper training, but it should be considered rather than allowing someone to continue to be aggressive or self-injurious when the punishment procedure could be changing their lives. In closing, I want to make it clear that punishment is a form of treatment that is covered in the ethical standards and has been proven effective. Punishment's one use is to suppress the behavior, and oftentimes it is seen as failing due to improper implementation. When punishment is immediate, consistent, frequent, and has sufficient intensity, then it will be effective and an alternative behavior can be taught. Punishment should always be considered when the cost of not punishing is greater than the cost of punishing.
Thank you to everyone for sharing your points. Throughout the debate, we heard some great points from both the pro and con sides. To conclude, both reinforcement and punishment have been proven to be effective treatments. Both have proven to be effective in reducing maladaptive behavior, with reinforcement using differential reinforcement of incompatible behaviors, alternative behaviors, other behaviors, and low rates of behaviors. And both reinforcement and punishment procedures have been able to terminate dangerous behaviors quickly. Punishment is often most successful when combined with another treatment method. Punishment procedures should not be implemented without proper training. A reinforcement or punishment procedure should be selected dependent on the function and severity of a behavior. Regardless of which procedure is selected, a BCBA who is implementing these procedures must obey the Code of Ethics. In the Code of Ethics, it does state that it is the decision of the client or client's family in the selection of treatment procedures. But it is also a BCBA's responsibility to educate the families on both reinforcement and punishment, and which will be most effective in that client's case. To conclude this debate, we will now have a short question and answer session. Our first question is, how can you help a parent understand the use of punishment procedures as part of their child's treatment plans, and what concerns might come up?
To help the parent understand the use of punishment, first, punishment must be clearly defined. It can be defined as a procedure that is used to reduce or eliminate a problematic behavior. An aversive event is presented after the behavior or a positive stimulus is removed in order to reduce the likelihood of the behavior occurring in the future. Another thing that is important to explain is that punishment does not always mean the child will be in pain or uncomfortable. It could simply mean that something is being taken away. Also, the parent should be provided with a rationale of why punishment is necessary. This would come from the results of a functional assessment or analysis to show the urgency of implementing the behavior. The data and graphs should also be shown to the parent.
Some concerns that might arise are parents might automatically assume that the use of punishment is something that will harm the child physically or result in negative psychological side effects. They might assume that the use of punishment procedures produces emotional reactions that could interfere with the child's learning and be unpleasant for the child as well as the people involved in the treatment. Parents might assume that the use of punishment may cause an increase in aggression from the child. It is important to explain to the parents the broad nature of punishment procedures and that the procedures used will only be implemented after the function of the behavior is determined in order to ensure that unnecessary punishment procedures are used. The parents should also understand that punishment will be used after reinforcement has been tried and been unsuccessful. Punishment results in a decrease in occurrence of a behavior, and something may be added or taken away from the child's environment to do so. Punishment does not automatically mean spanking, yelling, and timeouts. For example, if the behavior is for attention, then timeout is a less restrictive or aversive procedure that can be used. If the behavior is escape maintained, then blocking the escape and providing additional work is a punishment that is also less restrictive. These procedures will likely not result in harmful side effects, and when functional assessments are used prior, it will also ensure that the use of punishment is functionally related to the behavior. Also, inform parents that punishment is a short-term solution in order to address an immediate concern with the ultimate goal of reducing the behavior and then teaching an appropriate behavior to replace. But punishment may be necessary to quickly eliminate or reduce the behavior to manageable levels in order for teaching or increasing a new behavior.
Thank you, Jessica and Kayla, for answering our first question. Our second question is, it is important to remember that punishment can be negatively reinforcing to the person implementing the punishment. For example, when a parent yells at a child to be quiet and the child quiets down, then the aversive stimuli of the loud child is removed from the parent. If this increases the likelihood of the parent yelling at the child in the future, then yelling is negatively reinforcing to the parent while punishing to the child. Given this dynamic, what strategies can be put in place to help ensure that punishment is not overused or misused?
The first strategy that can be used when it comes to parents using punishment, since it negatively is reinforcing to them, would be to just inform the parents of what they're doing. Many parents don't even realize that they're creating a punishment situation for their kids because they're really just focused on what are they getting out of it. Then next, we could focus on informing the parents that what needs to be done is we need to figure out what the function of behavior is in order to then look at the replacement behaviors. At this point, we could explain to the parents how punishment does not teach an alternative behavior, and it would be more beneficial to be working on that replacement behavior rather than the parent becoming a punisher. We can explain to parents that if their child doesn't learn a replacement behavior, they're going to exhibit the same behavior unless the parent's always around to act as the punisher. In order to help their child, they should really find the alternative behavior that works and teach their child how to get what they want. It is not about always overcoming our immediate challenges with kids, but teaching our kids how to be successful as they move into the future.
Thank you, Greg, for answering our second question. Now I will have a few minutes for Kristen and Miriam to share their personal experiences related to this topic.
So overall, I've seen both the positive and the negatives of using punishment procedures, specifically timeout procedures. And what I've found is that in both cases, whether they're effective or not, the function of the behavior needs to be considered. It needs to be implemented consistently, and everyone needs to agree upon the procedure. So I found it effective when a child was engaging in aggressive and property destructive behaviors to gain attention, and we used a timeout procedure where there was no attention provided to the behaviors for 3 minutes. And then at the same time, we were teaching functional communication so that the child could appropriately request attention. And what I saw was that when the parents were involved, the caregivers were involved, that it was implemented for the appropriate behaviors. We found that the maladaptive behaviors decreased due to the punishment procedures, and the adaptive behaviors simultaneously increased due to the reinforcement procedures. I've also seen that punishment may not always be effective, and this example is with also the timeout, and it was in a school situation where there was a less trained staff member who was placing a child in timeout after they were having a tantrum, but the function of the behavior was escape. So since the function of the behavior was not addressed, then the behavior did not reduce, and the punishment procedure was ineffective. So what I have found and what I did was that I explained that that was not the correct procedure because the function was not attention. And so that procedure wasn't used anymore. And so like I said, as long as the procedures are implemented correctly, consistently, and that the appropriate function of the behavior is targeted, punishment in conjunction with reinforcement procedures can be effective.
And I would like to second that, Kristen. I have also seen reinforcement and punishment work together effectively. I have also seen situations where punishment is not so effective. I specifically remember one instance where it was in one of my clients' BIPs to engage in restraints if he continued to engage in self-injurious behaviors or aggression towards others for whatever function that it might serve. In this instance, he was hungry, so he wanted to eat something and there was no food to have. So we went through the BIP as we were supposed to. He ended up in a secluded area, and it instigated to where his nose was bleeding, and we found that to be unsafe. So the other staff members and I took it upon ourselves to end this situation and take care of the blood for the health concerns that it poses. But since we were not prepared appropriately for that given situation, it wasn't handled with as much care as it should have been, as I ended up in the ER the same night due to a busted face. But now we know in the future to prepare for these sort of situations and to think ahead in case the BIP does not work as planned, or any situation arises that might throw a corkscrew in that. So I think as long as everyone is properly trained, as everyone is making sure they're not tired and are switching out when they need to during these restraints, that it can be effective. But we just need to remember to always be on guard and not to let it get in the way of us providing effective treatment to our clients.
Thank you, Miriam and Kristen, for sharing your experiences. And thank you to all those who participated in this debate. And thank you, everyone, for watching.